Not sure if it's Crohn's or something else? You're not alone. So this person writes, I have one doctor saying it's Crohn's and I have one doctor that won't rule out something else. Labs came back negative for Crohn's and IBD, so I'm just sitting here like, now what? Yeah, you're not alone. So many people out there were diagnosed with IBS and then ulcerative colitis and then Crohn's and then something else or SIBO because they're all about the same. They all have a very similar presentation and there is no one test. There is no test that can come back positive and say that you have Crohn's. There is no test for Crohn's. There are just signs and symptoms. And after a while, you put enough of those signs and symptoms together and maybe you rule out some other things and now you say the most likely is Crohn's. But a lot of times this gets misdiagnosed just like a lot of other things in the medical system. So if you're not getting relief from your treatment, if you're not seeing improvements, maybe start to think that not just the treatments might be wrong, but the diagnosis itself. And if you want to know a little bit more about what else could be causing your GI symptoms, look to my YouTube channel or my Spotify podcast. I talk a lot about how Crohn's GI symptoms can come from the spine. The spine, the nerves that get to the intestines can be involved and that's causing all of your symptoms. And even better, I interview patients that were treated this way. Patients that were diagnosed with Crohn's, diagnosed with ulcerative colitis, did all of the treatments, all the prednisone, all the biologics, they were hospitalized, they had bowel obstructions, all the same symptoms that you would get with Crohn's, with ulcerative colitis, and they still weren't responding. And when we treated their back, everything got better. So if you're out there and you keep getting a lot of opposing information, maybe you need to start looking elsewhere.